Good morning, everyone. I'm Eden Lord, founder and CEO of the Dash Alliance, and I want to take a minute to thank all of you for coming to this session. This is a topic that has been very near and dear to my heart for a while now, and something that our team has worked very hard on for the last 18 plus months to bring to fruition. So we're very excited to unveil it today and get some feedback on what your thoughts are regarding collaboration in the rare disease space. So for us, it became abundantly clear over the last 18 months of hosting these virtual events and hopefully hybrid events soon for the rare disease community that we are very focused on education and awareness during our event sessions, which has been absolutely fantastic. But a lot of people walk away from the virtual event thinking, okay, I've got this laundry list of items that I'm concerned about. We've got some problems that we've identified within our patient community that we need to address, but how do we do that? What's next? What are the next steps? So Rare72 was something that we designed based very loosely on a hackathon style model to be that answer to that question of what's next. So we will just launch real quick here straight into what our vision is for the rare disease community, and that is to create a globally inclusive community that draws upon the expertise of people wherever they are in the world. We talk a lot about amplifying the patient voice of late, and that's fantastic. Absolutely need to continue doing that. But what we want to focus on at the Dash Alliance is really how we serve our patients, how we serve our families, how we serve caregivers, and all of the other affected stakeholders. So that for us means leveraging technologies and bringing them to people where they are, allowing them to engage in a solution-based event from where they are in the world, and allowing them to provide their input, share their experience, and feel like they're part of something that is really going to improve the lives of other rare disease patients like themselves. So to do that, we have built a proprietary platform that allows us to foster collaboration and gather input from all of our stakeholders, which would be, of course, our patients, our caregivers, their families, friends, our researchers, physicians, other medical providers, our students, academia is very, very important to include. Our nonprofits, NGOs, industries, and payers even play a role. And then, of course, our advocates with whom we wouldn't do anything without those. Very important advocate groups that participate in so much of what we do in the rare disease community. So when we look at the issues or the barriers and challenges to collaboration in the rare disease space, time and again, we're seeing geographical issues that are now being resolved, obviously, by these virtual event platforms and the opportunity to connect using technology in ways that we haven't previously done that, but really want to move away from the education only events and start implementing more of these solution-based events in addition to, don't replace, but in addition to the educational and awareness events, and really break out of the silos that we currently have our resources stored in and come together across different disease groups to solve common issues that we are facing as an entire rare disease community, and not just disease by disease. So when we sat down to look at what a solution would look like and examine what a solution would look like for the common challenges that we're facing in the rare disease community, we knew that we needed the enhanced opportunities for global connection. We've got that covered in our platform, but also we wanted to foster an environment where data sharing was encouraged, where people would come and share the resources that they have found helpful with the community as a whole, and then be able to vet those resources, which we'll get to in just a little bit. But also, when we have come to the point where we've got some identified solutions for these common challenges, have channels for implementation and understand how these solutions are going to work their way through the system and actually impact rare disease patients and families for the better. So as I said, Rare72, when we look at it from an overview standpoint, we want to source collaborative solutions to common challenges in the rare disease community and really build upon the existing hackathon model. If you're familiar with hackathons, if you're not, I'll explain briefly. So a hackathon historically is a very intense timed event where you would have a group of people, stakeholders, gather together in a room for a week or a weekend, or however long the team decides that they're going to host this hackathon event for. And there is a common goal or challenge that is kind of issued to the group, and people work together in teams to address this issue and come up with a solution. At the end of the hackathon, there's typically a judging panel. Sometimes prizes are awarded, but everyone has the chance to evaluate and see kind of what the offerings are and the solutions are before implementing them in the workplace or the community, wherever the current hackathon topic is being implemented at, whether that be a workplace, a school, what have you. So for us, we decided that in order to accommodate our rare disease partners and people who would be participating from different stakeholder groups, we would extend that intensive kind of 72-hour, 48-hour to 72-hour event and stretch it out over the period of a month. So what we do is we break down a common challenge. And for example, I'll use newborn screening because that is going to be our first challenge coming up in spring of 2022 is newborn screening and addressing that. We break that down into 5 different phases. The first one's going to be the identification of challenges and problem pitches from rare disease stakeholders. So we have a very generalized idea of what the challenges are in newborn screening from the aspect of there's no standardized federal RUSP. There's no consistency between states from what you're going to see from panel to panel. We're really lacking kind of a patient overview of the process to get a condition listed on the RUSP. There's just kind of different holes that we're seeing in the system that people are coming and bringing to us and asking questions about that we would like to see filled, hence the purpose of hosting a Rare72 event. So in the first phase, that's really our pre-event planning and addressing those issues. For newborn screening specifically, we are looking for solutions that enhance and standardize newborn screening panels that address ethical and social issues related to the initiation of screening, solutions that mitigate public mistrust of government health programs, and solutions that highlight clinical and ethical considerations in managing carrier detection. So a very tall order, but we've got a fantastic community of advocates, patients, and everyone else that is coming together, and ideally we'll come up with some fantastic solutions for this. So what happens during phase 2 is we have an open 72-hour window that is held on the platform, and it is live 24 hours a day for that 3-day period for people to come on and share whatever current resources they have found helpful. That could be a recent journal publication, such as the article that just, or the publication that just came out on a modernization of newborn screening at the end of December. It could be what your state's currently doing on the RUSP, or a link to your state's current RUSP. It could be a link to your state's Rare Disease Advisory Council and a conversation that they had on newborn screening. What our goal is in this first 72 hours is to really get an idea of where people are finding their information and have it gathered in a single location to create kind of a living wiki, if you will, so that we can then analyze all of the data and the resources that are shared with us and determine which ones are credible resources using a preset standardized set of criteria, but get an understanding for where people are at in the process for their disease group and what resources they are using to educate themselves and others moving forward regarding newborn screening. After that first 72-hour period, we move into the team working cycle. So before the event even begins, we host a 1-week boot camp to allow people who are participating in teams to get a better understanding of what the Rare72 process and hackathon model look like, how it works, and to pair them up with mentors that will assist them through the process and help guide them through not just the business aspect of coming up with a solution, but also guide them through conceptually, what do you need to be taken into consideration when we discuss newborn screening? So that's very exciting to have access to those mentors. We will be announcing who those mentors are for the newborn screening panel in upcoming weeks, but it's really, really cool to see teams that will be working with these mentors and hopefully coming up with solutions that are very impactful for the rare disease community from an aspect of considering where newborn screening fits in with early diagnosis and earlier access to treatments. At the end of that phase, all of our teams will present individually what their solutions are, and we will have judging for that from all the mentors of all the different teams, but also offer it up for kind of community voting. And then at the end of that, make the determination who our quote unquote winners would be, understanding that there's a place for solutions to be implemented regardless of who wins or loses. And also at the end of that phase, having a debriefing session. So we understand those channels that we'll be implementing solutions through and what that looks like. So this is really our goal of bringing people together and creating the solution-based event addressing specifically in this cycle newborn screening, identifying what the common challenges are from the people in the rare disease community who are living this every day, and they're dealing with the challenges every day. So this is really just an opportunity to leverage a platform that we have built to bring the expertise of people who are working in newborn screening every day and who have a vested interest in newborn screening to come together in a single spot, all at the same time, and collaboratively work towards a solution. So we get pretty excited about the concept. Newborn screening, as I mentioned, is coming up in 2022. There with my camera. And we will be focusing on building out those teams very soon. So registration for that, I believe, opens in February. I will have to check the exact date, but everyone is welcome. You know, if you're a rare disease stakeholder, we want you to participate. We want you to engage. If you do not currently have a team in mind, sign up. We will help you find a team. We will help you find a mentor, because we're all after the same goal here, and that is to improve the newborn screening system as it is now, and really provide some new options and some new avenues for standardization, growth, and, as I mentioned, you know, mitigate maybe some of the public mistrust and really create a program that makes an impactful difference for people. So we're excited. We've got a lot of other fantastic topics on tap. Decentralized clinical trials for one. I am checking out our rare72.com website right now, just for a quick reminder of what we have: barriers to early access programs for patients, cultural challenges, international barriers to care, building patient support programs. You know, we've got some pretty meaty topics that are coming down the pike here with the Rare72 cycles, and that have been determined in part by feedback from the rare disease community, things that we have heard directly from our rare disease partners and organizations that have hosted events with us, and really just one-on-ones with people in the rare disease community, things that we're seeing every day, not just from stakeholders in the patient communities and advocacy communities, but from research aspects and industry as well. So as I said, we are very, very excited. We hope that you will join us for this type of event. It's new, it's brand new, and it's going to take all of us working together in a collaborative way to move that ball forward, and we're ready to do it. We've got a great tool that our teams work very hard on that I'm very, very proud of. And we're always open to collaboration and always looking to implement that next solution. So I appreciate your time today. If you have any questions, please don't hesitate to reach out. Please feel free to sign up. We will let you know as soon as registration goes live, and we hope to see you at one of our upcoming Rare72 events. Thank you.